Welcome back. Now, the Gauteng Health Department has paid a suspended senior employee over 4 million rand over the past 2 years. Advocate R4m is the department's legal services chief director, and she was told to stay at home after the Public Service Commission had found irregularities in her appointment. DA member of the provincial legislature, that's Jack Bloom, joins me now for reaction to this. Jack, good morning to you. Thank you so much for your time. I mean, what do you make of this particular development or, story within the Department of Health? I mean, when I saw the amount, 4 million rand, my first thought was surely that money could have been used for other better use.
Well, absolutely. And the only reason we know about it is that I asked a question about it because I was puzzled why we had a head of the legal department who didn't seem to be doing her job. So it turns out she's been sitting at home since July 2019. That's more than 3 years. And for that amount of money, it's actually about 4.7 million rand. You could get, at least 10 senior nurses working in our under-resourced hospitals, or they could have fixed machinery, they could have done all sorts of things. It's a huge amount of money. And unfortunately, it's another example of mismanagement by the department that hurts people in hospitals, because we should be spending money effectively, not on people who pay to sit at home instead of doing their job.
And how does the MEC of Health justify this decision?
Well, basically, she inherited it, but it goes back to a former MEC of Health, Gwen Wamagopa, who insisted on hiring this advocate because it was her friend. She previously employed as her chief of staff in 2006 when she was the former. She was previously the MEC of Health in a previous term, and advocate. Mpelecheng had in fact been dismissed in 2006 on various charges, but then apparently she was absolved of that. But when Gwen Wamagopa came back as MEC for Health, she insisted on having her buddy back in the office. So according to the Public Service Commission, it was an irregular transfer from the Department of Water and Sanitation, and now it's just dragging on because the Public Service Commission said the department need to do something urgently about it. Advocate Mpelecheng challenged this in court, and now there's only a court date next year. So in fact, we'll probably end up spending at least another 1 million rand on this whole thing before it's finally concluded. It's just pure mismanagement from start to finish.
I was about to say that we're having this conversation because it is mismanagement, it's irregular appointments, and I wonder if the Gauteng Health Department will get their act together. But in the meantime, what does it say about what's happening within, the health department in Gauteng, and what needs to be done?
Well, I think it's just plagued by mismanagement, corruption, and I think the big issue now, of course, is the stealing that's been going on from the Tembisa Hospital, and the revelations of what's been going on there that murdered whistleblower Babita Deokaran's tried to stop. And the reality, again, is that all of this is coming out now, not because the Gauteng Health Department was doing something to uncover corruption, but journalists uncovered what was going on at the Tembisa Hospital. Frankly, I think there's a cover-up of what's going on in this department. I think that it's rotten at the very top. And after all the promises that have been made, especially by the Premier of this province, Premier David Makura, he said 8 years ago when he became Premier that he'd look for a, quote, urgent turnaround of the department. And quite frankly, I think it's in a state of crisis. In fact, things seem to have gone worse. And the reality is that we have incompetent people at the top. They're dishonest people as well. They cover up things like this. And at the end of the day, people suffer in our hospitals.
Yeah, I mean, in as far as this payment is concerned, Jack, what do we know about it? Is it still ongoing? It's 4.7 million rand, if my calculations are correct, over 4 million rand so far being paid to the senior employee. Is Advocate Mpelecheng still receiving this money? Will this salary or payment still be ongoing? What's the status of this case?
Well, she's going to be paid for October as well, and November and December, until this case finally gets to court the taxpayers are paying for it. Patients are not getting what they deserve because of all this mismanagement. And, to be honest, every time I ask questions like these, I find out more people are suspended, being paid millions on pay, and it's just a shambles.
Yeah.
The department doesn't know how to manage themselves properly, and people suffer because of it.
Well, I thank you for speaking to me about this. Dear Gauteng Health spokesperson Jack Bloom, of course, joining us about this matter. Jack Bloom, of course, being the Health Department and MPL, rather, DA-MPL, just trying to get that title correctly, DA-MPL, talking more about this irregular appointment costing taxpayers up to 4 million rand, if not over. And it seems those payments will still be ongoing, according to Jack, for this month on forward. We'll keep an eye on the story for you and we'll give you an update. All right.